What's that?
Session 1, 2, 3. 3. Session number 3, right? A couple of things. Since we have Bethany, say hi. She's joining us. Okay. And Kayla's another one from the night class. She's joining us too. Say hi.
Hi.
Okay. Yeah, so she externed at Valley Hospital, but you already did your interview at Spring Valley Hospital.
You did?
So
She got it!
she got it! She got another per diem, so okay. But they always require, hospitals require you to be certified. That's why we're doing this, right? We have 2 students who just graduated, and their Smith's pharmacy manager requires them to be certified. So they're given the offer, but there was a condition. That's Smith's. 2 different Smiths, huh? So anyway, just a heads up. Okay, let's start. A couple of things. Beth, you're in. Because I'm using my phone, I can't check this too. Okay? You have to be in the group. Okay? PIMA, exclusive, and you have to be in the challenge as well. Okay? Justin, I saw that you haven't done anything in the challenge. Okay. So I emailed NAS.io and they told me you can't see the leaderboard if you didn't put a fixed finish date on the challenge. So I can see who did it, who did not do it, but I cannot edit it anymore. So it says the next time you create a challenge, you want leaderboards, you should put a fixed date. Okay? So because we wanted it to be a trailing thing, we did it. Okay, a couple of things. What was your homework last week? Study that. 25 flashcards, right? 25 flashcards on what topic?
Drugs.
Medications. Okay? Flashcards is different from your practice test. Okay? What's the next? Who's on that checkpoint?
We already did it.
Okay. Are we still having problems on uploading screenshots because I needed image instead of document?
One page is like checkpointing, so I don't know what happened.
Okay, any problems? Just one page. Okay. And then who's on the next checkpoint? Okay, what was my next checkpoint?
Questions.
You have one question for me. Ask me one question from your 25 decks. 25 flashcards. Okay. Each 25 flashcard set or batch or deck is different from each one of you because it's random, correct? Okay. There's 70 plus flashcards, but there's 200 plus practice questions. Is that clear? Or is it the other way around? No. There's 200 plus, I think, practice questions.
225, something like that.
Yes.
Study questions 75.
Okay. Study questions 75, and then flashcards 200 something. Okay, so she's right. Just flip flop. Okay. Do you remember your flashcards? Okay. Can you choose the topic? Like, okay, nervous system. You can't, right? It's random. Okay, so let's go over them. Which among your 25 flashcards are you not yet familiar with? Remember, the night students are on sequence 1. The morning students are on sequence 2. Sequence 1 is nervous system. Sequence 2, we haven't started it yet. Okay, but it is cardio, respiratory, gastro. Remember that? But you've had other sequences already, correct? Okay, what's sequence 3? You remember sequence 3? Hormones, reproductive system, diabetes. Is that it? What's sequence 4? EENT. What else? Antibiotics. Where's cancer? I think sequence 4 as well, right? Anti-cancer medications. Okay, so you do have some pharmacology knowledge. So let's start with your study decks. Okay. Dad, did you get to do that? you're trying to catch up?
I'm trying to.
You're trying to catch up, okay. It's okay, there's no expiration on things, okay? I haven't given any tests yet, yeah, on the medications, because I want you to still strengthen everything, okay? Let's start at the back. Ashley, can you remember your 25? I know you take notes, okay? You have questions about a specific drug, question, flashcard on your 25 deck. She brought notes last time, remember?
I want to know like the other interactions of metformin. Like,
Other forms of metformin?
No, like drug-to-drug interactions of metformin.
Oh, drug-to-drug interactions of metformin. Okay, drug-to-drug interactions of metformin. What's metformin?
Metformin is for diabetes.
It's for diabetes, anti-diabetic. Okay? Is that a generic or a brand?
That is a brand.
F, right?
Yeah.
Brand name, popular brand name.
Glucose.
Glucophage. Okay, Glucophage. Very good. Okay? This shows up on the PTCE. Okay. Those who have the top 200 drugs ebook, pull it up.
I can.
Oh, I know. Okay. Your top 200 drugs. Class. Therapeutic class, anti-diabetic. What's the pharmacological class? Okay. And the insulin, what type of insulin? What type of insulin is this? Usually you'll see oral anti-diabetic, right? Because it's an oral. Okay. Yeah. And then another class. Biguanide. These are a couple of things that you may see. Biguanide. Okay. Pharmacological class, biguanide. Therapeutic class, anti-diabetic. Okay. Oral anti-diabetic. Okay. Insulin. Okay. Insulin, what do we use insulin for?
Diabetes.
For diabetes. So what happens in diabetes? There's an increase in sugar in the blood. What's this sugar in the blood called? Okay. Glucose. Correct. So what does insulin do? It lowers the sugar in the blood. These are possible questions on the PTCE. Okay. What is glycemia? Gly, from the word glucose. Emia, in the blood. Sugar in the blood. Okay, are you following? Glycemia. Okay, so you said insulin is for diabetes. So what do these people have when they have diabetes? An increased sugar level. Okay, if insulin is the treatment, what does insulin do? Lowers elevated sugar levels. Are you following? Okay, so when you hear the word that showed up, okay, hyperglycemia, what does it mean?
Hyperglycemia is excess.
What's hyper?
Or more, a lot.
Increase, right? Because it's hyper. More, a lot. The Kathy said, right? Increased glucose in the blood, right? The opposite of hyperglycemia is
Hypo.
hypo. Decrease glucose in the blood. Are you following? Okay. So if insulin decreases glucose in the blood, this shows up. What type of agent is insulin? A hyperglycemic agent or a hypoglycemic agent?
Hypoglycemia.
Remember that insulin is a hypoglycemic agent. You following? This is when it gets confusing. What is another term for diabetes? Hyperglycemia or hypoglycemia?
Hypo.
Because that can be a question. What is another term for diabetes? Diabetes, I said, is it hyperglycemia or hypoglycemia? It's hyperglycemia because it's a state of having an elevated sugar levels. Watch this table. You don't have it yet. What is the opposite of insulin? What's the drug or chemical? Starts with the letter G. G. What does the opposite of insulin?
Glucagon?
Very good.
Glucagon.
Glucagon. Okay. Take note. How do you know whether a drug is for diabetes? Here are the tips on your top 200 drugs ebook at the back. Okay. There are most commonly used prefixes, roots, and suffixes, and here are the triggers: glit, glue, and gly. If you are to make an educated guess, okay, and it's a multiple choice question anyway, and you're asked of a drug or a substance or a medicine for insulin, find the generic names that has glue, glit, gly. Okay? Insulin versus glucagon, this shows up. Okay? Insulin, you said, is used for diabetes, right? So the use of insulin is what?
Lower blood
To lower
sugar.
glucose levels, correct? Okay. So what type of agent is insulin? A hypoglycemic agent. You following? This is how it's going to throw you off because they go back and forth, trying to test whether you understand what's being asked here. Okay? So what's the use of glucagon? It does the opposite. So if your sugar level is so low, these are your sugar pills. Okay? In an insulin kit. Yes, madam.
Hey guys, so we have so much bread left over from
The other
when we did
day.
the hot dogs. We have hamburger buns and hoagie rolls from Costco. Does anybody want, since I don't have to get rid of them?
Yeah.
Okay. I'll take that home. You want both? You want a hoagie?
I like the burger. I like the burger buns. Yeah. Thank you.
I'll keep it for us.
Yeah. I'll burger it this weekend. Yeah. Thank you.
I'll make some.
Okay, I got 4 more.
I just don't want it
burgers,
to go to waste. Yeah.
guys. Yeah, I don't want to throw away food.
Yeah.
Anybody
Thank
else
you.
want burgers? I don't have, I have 2 more.
They're good bread. You had them the other day. Cody right here. Yeah. Again, you guys have school on Monday, huh? You have school on Monday. You have little siblings. It's just them, not you. Thank you so much. Okay, let's go back. So glucagon in an insulin kit, there's sugar pills because it's easy to overdose on insulin. Okay, easy to overdose on insulin. So when you overdose, you gotta take what? Because your sugar is gonna go way, way, way down. You gotta take your sugar pills. Okay. So for the use of glucagon, remember, their function are opposite. For the use of glucagon, what does it do? It increases, I'm gonna do red, glucose levels. Okay? So what type of agent is glucagon?
Hyper.
A hyperglycemic agent. Okay? So for the use, if this decreases glucose level, it treats what?
It treats low blood sugar.
Okay.
It treats high blood sugar.
It treats hyperglycemia. Are you following?
Yes.
This is how they're going to test you on PTCE because it's testing you for comprehension. And you're going to get thrown off if you don't understand the problem. Okay? So, glucagon, what does it treat?
Hypoglycemia.
It treats hypoglycemia. Clear?
Yes.
Okay. One more very favorite question on insulin is math. A math question. Why? Because it's not a 1:1 conversion. Okay? Very common to show up on insulin question. How many units?
Is it minimum?
Yeah.
100.
For insulin calculation, know this. Never forget. You'll not give it to you. You have to know it. Okay? 100 units is
1 ml.
1 ml. So it will show up as a word problem. This is part of patient safety. A lot of people, well, it's easy to overdose on insulin, okay? Because it's not a 1:1. Okay? So let's solve 2 quick problems. Patient is given a prescription of 12 units of insulin. How much is that in ml? Can we do ratio and proportion?
Yes.
Yes, we could, okay? As long as you know this, but you have to remember, they don't give this to you. Okay? 100 units is 1 ml as 2. 12 units is 2. X ml.
0.12 ml. 0.12.
1 cc is equivalent to?
1 cc is equivalent to
1 cc is equivalent to 1 ml. Correct. Remember this? I was at Desert Springs Hospital. There was a phone call. The nurse didn't know that cc is exactly the same as an ml. The cc is more commonly used, in European countries. Any questions? Okay. Those are the most common questions I've seen on insulin. Okay? Is there a drug-to-drug interaction on insulin? I haven't seen that come up. Okay? But there's a drug-to-disease interaction. And what is that? You do not give insulin to what? There's an overdose, right? So if insulin is used to lower glucose level, an overdose can lead to
hypoglycemia.
hypoglycemia. That's another question that may pop up. Okay? If you overdose on glucagon, what will it lead to?
Insulin.
Hyperglycemia. This can be thrown in so many different ways. A, B, C, D, A, B, C, D. Okay? Okay. What should we not give with insulin? I didn't see that pop up though. Yeah. These two counter each other. So if you are to know which one is the opposite function of insulin, that would be glucagon. And which one would be the opposite function of Glucagon, that would be insulin. Okay, let's move on. Justin, did you make that a deck?
It wouldn't let me, but.
Why? You were the one who did it first.
It
Because.
wouldn't let me, like, it wouldn't do, at least medications.
Why is that?
I'm not sure, like, I can do like the laws and the sick codes, but like, everything else, like, can't do. But, I mean, I've watched it, so.
Okay, so we'll take care of that after 1 o'clock, okay? The tech side after 1 o'clock. We'll just finish the lecture side for those who were able to do stuff, okay? Cody, give me one question based on your deck that you want me to elaborate on. So it'll seem like we're jumping from one topic to another. That's fine, okay? But I'll tell you what I saw on those particular topics, okay? Give me one drug, one. Remember this, that's a very common question, the conversion, the insulin and the glucagon. Good start though, that was a really good start. Because this is one of those drugs that's dangerous, okay? Calculations are dangerous. Oh, another one. What examples of drugs use the measurement unit? So now you know it's insulin. What else can you think of? Heparin is in units. Okay. What else? Vitamin D, right? Your ADEC, your fat-soluble vitamins are in units or inter units. Okay? But heparin is also in units and insulin is also in units. Would you like to give me one? Drug to disease interaction. Cody doesn't have a copy, so I'll wait until I could give him the top 200 drugs. Now pull up your top 200 drugs ebook. Oh, shucks. Okay. So I gave them an ebook that has all 200 drugs with a drug to drug, drug to food, and drug to disease interaction. And there are a lot of common ones that show up. Okay.
What page is that?
At the very back. It's in the table, okay? You got your phones? Okay, I'm using my phone to record, so. If it's on the phone, what page? 95. Okay. You got that one. I swung by the night, right? Kayla, you got that, right? I gave you in a text. So it's only Cody that doesn't have that at this point. I'll get him access to it. Okay, let's talk about some of the areas of the board. Half my tissue is almost gone. Thank you so much. Nice students, my allergen. But it's okay, I just kill myself every day. Thank you so much, Yanni. Okay, let's talk about, I like this one, drug-to-drug interactions, drug-to-food interactions. Yes, this always shows up on the PTCE. Under medications and under patient safety, 2 categories. Okay, drug-to-drug, those are interactions. Okay. We have what we call a drug-to-drug interaction. What page on your mobile phone? Kathy, don't yawn before I say it. Who was that?
That was tough.
That was Ty? And that was Kathy. Drug-to-drug interaction. We have drug-to-food interaction. Interactions. This is a lot, okay? And drug-to-disease. And drug to supplement as well. Your supplements are food, considered as food by the FDA. Okay? So when I revise the book, I'm going to add the drug to supplement interactions. Okay. Drug to drug, drug to food, drug to disease interaction, drug to supplement interactions. Where are you gonna see this in the pharmacy? What alert are you gonna get?
DUR.
Thank you, good job. These are possible DURs. These are not the only one, okay? We have drug to age as well, okay, drug to gender as well, okay? Or you jump to 18 years old, so you're no longer considered pediatric, okay? But you still have a prescription from a pediatrician. This is DUR, okay? What does DUR stand for?
Drug utilization review.
Drug utilization review, okay? Homework. What are the different DURs? It starts with DUR 0. There's a DUR 1, 2, and so on. And tell me what they are, okay? So when we meet on Monday, we're going to discuss the different DUR numbers, okay? The different DURs, because I'm going to put this on the side for now. That's homework for, Wednesday. I come back Wednesday, okay? That's homework. So it's not just 0 and 1. There are other numbers too. Find that out and what each DUR means, because I'm going to tell you which one's the most common one. One is requested by patient, a tip. One is requested by the prescriber. One is not available. There's no available generic. Okay? So know those numbers because they show up on the PTCE. So we'll discuss it when we come back on Wednesday.
Oh, that sounds like the EAWs also.
Yeah. DAW, sorry. So
Not
that's a DAW, I'm sorry.
I wasn't like, that sounds like the
Thank you, Kathy. Thank you, Kathy. A DAW is what I meant. Thank you, Kathy.
I was like, huh?
It's a DAW. Thank you. Friday. What does DAW stand for?
Dispense as written.
Dispense as written. It's also connected to medications, okay? DUR is the alert for your drug to drug, drug to food, drug to disease, drug to supplement, drug to age, drug to gender, okay? Those are examples of DUR. Now let's talk about some interactions. Okay, perfect timing, Valentine. Okay, can you guys give me some drug to drug interactions? Meaning this drug should not be taken with this drug or this class or this group of drugs should not be taken with this other group of class. Steve said something. Louder, Steve.
Warfarin can't be taken with vitamin K.
Good job. Okay.
Or statins with grape.
One by one.
My bad.
Warfarin, is this a brand or a generic?
That is
Brand?
No, that's the brand.
Warfarin's brand. Generic.
It's both.
No, Warfarin is the brand.
Tell me what the other one is.
Coumadin.
Okay, I'll write it down now. Now, which one is the brand? Which one is the generic?
The bottle of Warfarin is brand. Coumadin is generic.
Ashley.
Damn, Dr. Warfarin is generic and Coumadin is brand.
Warfarin is generic.
I tried.
It's okay, good try. Right? Good try. Warfarin is the generic, Coumadin is the brand. Here's how I can tell you to remember this. The RINs, heparin, warfarin. Okay? They're blood thinners. They're not in the book, but I'm telling you. Okay? And remember, those syllables only work for generic names. Those codes only work for generic names. Okay? They're blood thinners. Okay? Any blood thinner, what does it do? Blood thinner.
It gives your blood.
It is your blood, right? They're also called anticoagulants. Okay? When you say coagulant, anti-clotting, right? Okay. Vitamin K, okay, does the opposite. Vitamin K is your clotting factor. So why are you going to give a patient this and then give them this? Cancels out the effect, right? So a number one no-no for anticoagulants or blood thinners is vitamin K. You following? Hint, hint, wink, wink. Vitamin K is not the same as potassium. Now I'm gonna start with food. Okay? Following? Okay. So, what's a potassium-rich fruit? Bananas. That's why we call IV bag rich in potassium or high potassium content banana bag.
Oh.
Okay? It's a cure for hangover. So if you, Justin, if you drank too much, go eat your bananas. The next day.
I've been off. I've been
You gotta try Jen. No, I don't think so. Anyway, so
You don't call no sugar?
No. That's a
Okay.
whole different
vitamin
thing.
K is not the same as potassium. Now let's talk about vitamin K. Sometimes, or many times, the question on the PTCE will not give you vitamin K, but instead will give you food.
Leafy greens, the banana.
So leafy greens are examples of vitamin K. They're rich in vitamin K. So if you see leafy greens in there, those are actually the correct answer too, right? Give me an example.
Lettuce.
Spinach, kale, what else? Brussels sprouts.
Broccoli.
Broccoli, okay? In my audio lecture, if you listen to me, smoothie, okay? My son's dad had nose bleeding problem, like really bad for a long time, okay? So I told him, put broccoli in your smoothie, okay? And that kind of stopped. Why? Broccoli, like you said, logical again, is rich in vitamin K. It is a clotting factor. He put a lot of spinach, a lot of broccoli in his smoothie, and it helped with the nosebleeds. Life hack connected too. Okay? So the answer can be either the leafy greens or the vitamin K. So heparin, warfarin, coumadin do not give with vitamin K. Vitamin K, leafy greens. Are you following? That shows up on the PTCE. Good question. Okay. Ty, did you raise your hand? Okay. So we have one drug to drug, but it connected to the drug to food as well. Right? Okay. And the drug to disease. So if the patient has thin blood, do you give vitamin K? No. It's even going to be a problem, right? Okay, Josh, give me a drug to drug.
Drug to drug.
Mm-hmm.
All right.
You should have your own notebook, huh, for the PTCE, because I'm like squeezing my brain right now.
Yeah, sure. Warfarin and acetaminophen.
Warfarin and acetaminophen, yes. Warfarin and acetaminophen. Okay, what's acetaminophen? Tylenol. Okay, what does it do?
Lowers your
Because we don't have the internet when we're done with the review. What? Because we don't have the internet when we're done with the review. We can go. Yes.
I've been waiting. I've been waiting for them to come.
I know, right? Because it's so hard to work on anything. Okay, so
Who is that?
Michelle. But that's according to Lisa. Okay, so why is Tylenol or acetaminophen not allowed? Did you see that in the
It makes your blood increase. Increase bleeding.
increased bleeding?
Increase
Okay.
INR.
I haven't seen that on the PTCE measure, but it's true and correct. Okay, which leads me to talking about Tylenol and ibuprofen.
It's okay.
Because this shows up. Tylenol, brand or generic?
Brand.
Generic?
Acetaminophen.
Acetaminophen. in other countries, what's the generic called?
Paracetamol.
Very good. The only one I can think of that has a generic, different generic, no. Motrin. Generic? Ibuprofen. What's ASA? Aspirin. Take note of the spelling, most commonly misspelled by Americans. In Spanish? Aspirina. Okay, let's talk about these things. Tylenol, acetaminophen, in other countries, paracetamol. Okay, it's the only generic that's different. If you want to be helped, you're in other countries, use the generic name, except for Tylenol, right? Because the generic name is the universal name of the drug. Okay, it's based off of the chemical configuration of the drug. Okay, let's talk about the class. Tylenol. What class is Tylenol? Very good. It's not an NSAID. Common mistake. Antipyretic. It's not an NSAID. I'm allergic to NSAID. That's why Tylenol is the only thing I can take. It's an antipyretic. From the word pyro, which means fire. Yeah? Anti is against. So what does it do? Against fever or lower elevated temperature. Right? It's not an NSAID. Common mistake. Okay? Motrin and aspirin is an NSAID. NSAID stands for non-steroidal anti-inflammatory drugs. Which tells you steroids, what do steroids do?
They reduce inflammation.
They reduce inflammation. But these ones are anti-inflammatory but doesn't have steroids in them. Correct. You following? Okay. Number one side effect of Tylenol, everything I'm talking about right now shows up on the PTCE. Okay? Number one side effect of Tylenol is, I heard it, liver damage. And that's why on your Tylenol bottle it says take no more than how many doses? 5 doses in a 24-hour period. Okay? Because it damages your liver. For NSAIDs, what's the number one side effect of NSAIDs? Gastric irritation. 2, gastric bleeding. So here's how it's going to go on the PTCE. Bless you. They're going to ask you, it's situational, okay? Case. Patient comes complaining of gastric bleeding, which amongst this drug, okay, may have caused the bleeding, or would you be alerted on, okay? Which amongst this drug is going to cause the alert, okay? And you will have a couple of options. Which one would you choose? Either a Motrin or an ibuprofen, or an aspirin or ASA. Is that clear?
Yeah.
Just for fun fact that we don't use it anymore. What's the abbreviation for acetaminophen? Okay. Side effects. Yeah. They're leaving. No, we're not leaving. Like they're kicking us out. Okay. No, we're not leaving. I have a full house. No, we're not leaving. Yeah, a few more minutes. All right. Okay, so it's going to be a case format. The patient comes in and complains of this, right? So you're going to choose if it's gastric irritation or bleeding, this. So what's our solution for patients who need to take anti-inflammatory like NSAIDs? Eat first. So with food. Good job. Is that your PTCE notes?
Yeah.
Good job. There's an AI I'm using that I love. So when I record and I slap the recording in there, it's going to give me a summary and study notes, and I'm going to give those to you. Bullets. Okay, but I want you to take notes on your own too. Yeah, it takes a while to process. Oh, Miss J and I love tech when it's for efficiency. Next. Drug. We'll talk about one food, okay? Because it always shows up on the PTCE. Jenny, Janie, your next time. How much time we have? 12 minutes? 17? Yeah, 17. It's 43. Thank you so much. Okay. This is a big culprit all the time. Grapefruit. It always shows up on the PTCE. And I think it showed up in some of your practice tests. Yeah? Because there's a lot of interaction with this. Okay? Grapefruit or grapefruit juice? Okay? Tylenol is one. Okay? Because it's metabolized by the liver. Okay? And it affects, in case you're asked, this is in the liver. Okay. Grapefruit, number one that usually shows up on the PTCE. Can you guess? I heard it. Ashley? Statins. We call them statins, but they're not the correct group. Nowadays, we call them statins. They end in statins. Are you following? Okay, example. Simvastatin. I'll start. Jade. Oh, you're not there yet. Sequence 2. Atorvastatin. Don't they end in statin? Rosuvastatin. They end in statin. So statins are for? Correct. High cholesterol levels. What is this condition called?
Lipid. Something.
You're getting there. Chop, chop. Okay. There you go. Hyper is an increase. Lipid pertains to cholesterol. Emia is in the blood. High cholesterol levels in the blood, that state is called hyperlipidemia. So what do you think statins are called? What's against? Anti-hyperlipidemic.
So many words.
But Americans always have a hard time pronouncing it, so we shortcut it to anti-hyperlipemic, anti-lipemic. All of those are one and the same. Okay? Just like they said, the wrestler Batista, they said Americans cannot pronounce his last name, but his real last name is Bautista, which is a Filipino last name. His dad is Filipino. Yeah, so he just dropped this one. Because Americans can't pronounce it. That was the history, he said. Anyway, Batista. Okay? So anti-hyperlipidemic is the same as anti-hyperlipemic and anti-lipemic. All one and the same. Okay? So the test can throw those questions. That's why I say those words. Okay? So statins are anti-hyperlipidemic, which is your therapeutic class, correct? Because the therapeutic class tells you what the drug does. But what is the pharmacological class? The pharmacological class is what? The chemical configuration or the chemical name of the drug. Starts with the letter H. On the PTCE, it will only ask you class. So they can use this or they can use this. What do you think is this one? I heard it. H. H. What are statins? H. M. G.
Oh,
HMG.
You have to. Long, huh? So because they're asking the class, they can give options like anti-lipidemic, anti-lipemic, but they can also give you options like the pharmacological class. So this is what I tell the students. If you can't pronounce it, you cannot picture it, that's a pharmacological class. Okay? It's a therapeutic class. If you convert the medical term into layman's term, then it tells you what it does. That's your therapeutic class. But on the PTCE, they're not going to be specific. They're just going to say what class. So you have to know both. You following? So when it's statins, HMG coenzyme A reductase inhibitor, the book is grouped per class as well. Okay, so you can start with, I started off with nervous system on the book. Okay. Grapefruit and statins. Acetaminophen and statins. No. Okay? In case you missed some of these lessons, I sent you the link to the audio recordings. I had a lot of stories, even that smoothie story was in there. The smoothie story was there. The statin story was also in there, I think. My mom had what?
Oh, grapefruit.
Yeah, this prescription. She loves grapefruit, but she has this prescription.
You were like, you have to choose grapefruit.
I asked her, you choose, right? Go to your doctor, have your doctor replace your meds, or stop the grapefruit.
Did she stop the grapefruit?
She stopped the grapefruit.
Oh,
I know. Okay. Drug to food.
In your book, you have drug to food as CCB as well.
Yes, I do. The only thing I think I missed on that book that when I revise it is the drug to supplement. I'll add the drug to supplement in the next version. Okay, I'll edit that one. But the drug to supplement kind of crossovers drug to food because supplements fall under food in the FDA category. Okay, but remember, supplements are not FDA approved.
Cooked onion.
What else can you remember?
St. John's.
Ooh, awesome. Thank you. Supplement / food. Rainy, your turn. The St. John's wort falls under the topic complementary and alternative medicines, which is also part of the PTCE. Thank you so much.
We need a better eraser. When does it need that?
This is sequence 1. I know this word.
Someone wants to clean it later?
St. John's wort without an H. Right? Complementary and alternative medicine, it's a supplement. It's also, because it's a supplement, it's a food. It came from a plant. Yeah, it came from a plant. Most of our drugs back in the day came from natural sources like plants and animals. Okay? St. John's wort has what property? Correct. Antidepressant. So, do not give to anyone already taking antidepressants. It is a choice. You get it? You can't have both. Okay, so it's either you choose the complementary and alternative route, or you choose the Western medicine route. Is that clear? But you should not take it with another antidepressant. Okay? St. John's wort. One more. Sequence 1. SSRIs. SSRIs have a lot of did not give. What's SSRI? Selective serotonin reuptake inhibitor. Do not give with. Do not give with. Another group. Drug to drug.
Antibiotics.
Your sister has it?
I heard some. SSRI should not be given with MAO inhibitors. What else?
Talked about yesterday.
Huh?
Different SSRI, but different. Remember yesterday? One of our drug words? No.
Oh.
SSRI, no to MAO inhibitors. What else?
Just like SSRI, but another one. Yes, rating.
SNRI. Okay. Let's talk about MAO inhibitors since you mentioned drug to food. Sequence 1. MAO inhibitors should not be given to what food? Rich in?
Trey, that one where Trey,
This all shows
it's in
up.
meat, it's in meat. Charcuterie boards.
Charcuterie boards, cheese, sauerkraut, like kimchi, fermented ones.
I just don't know how to say you, Trey.
Thai.
Thai, should not forget this. Thiamine-rich food.
I remember you telling me this.
Always shows up on the PTCE. What are MAO inhibitors? What do they do? Anti? They're also sequence 1. Mental health drugs. They're also antidepressants. Should forget. We have tricyclic antidepressant. We have SSRI, SNRI. We have your MAO inhibitors. Your MAO inhibitors, monoamine oxidase inhibitors, should not be given to thiamine-rich food. The question can be this, or it can be disguised in an example of cheese, beer, wine, sauerkraut, so anything that's fermented. Okay? So it can be examples. Food can be examples. Okay. I think that's pretty good. It's a lot of good questions. Good leading into the next one and the next one. Do you remember something from your deck?
I just
Drug that you'd like to share. This time you are doing sharing the info.
I just remember seeing a dosage I didn't recognize. It was like a DOT.
Oh.
I think it was ODT, something like that.
ODT?
ODT.
ODT stands for orally disintegrating tablet.
Oh.
Orally disintegrating tablets. What does that tell you? It's a tablet that dissolves, right? Orally in your mouth. Orally disintegrating tablets.
For people who can't swallow?
It's also for the flavor. Like I have a Meclizin, like a bubblegum flavor. Yeah. Okay. ODT stands for orally disintegrating tablet. I'm gonna write it.
The example was clonazepam or clonopin.
Orally disintegrating tablet. Good job. Next. Oh, you're catching up. Steve, can you give me something? Oh, you didn't make a deck.
No, I won't.
You got something from your deck? Do you want to share?
Do we have to know the contraindications?
Yes, we just started with interactions because Cody said Can we have some interactions like drug to drug to food? That's a lot, huh? That falls under medication and patient safety. Big, big, big. So we're gonna continue with that one too. Okay, Josh, did you make a deck?
I did.
Okay, can you share one?
Yeah, sure. I think it still regards to drug to food interaction.
Yeah?
And
Share the info.
Yeah, sure. For this one, it would be hydroxychloroquine.
Hydroxychloroquine.
Yes.
Say hydroxychloroquine.
Hydroxychloroquine.
What is it about?
And this particular drug is used for lupus, rheumatoid arthritis, and malaria.
Correct. So when I heard hydroxychloroquine, malaria was the first thing that came to my mind. Lupus. Okay.
As for my question, since I looked over the normal adult dose and read the SIG, it says take with food or milk. My question is, why milk exactly?
It coats your stomach.
That
Think
makes
of
sense.
milk of magnesia.
That makes sense.
Coats your stomach when you see take with milk. Okay. But there are drugs that says do not take with milk because it binds, like tetracycline should not be taken with milk because it binds with what? Tetracycline and precipitates. So do not give it to children younger than 9 years of age because it will cause
Teeth discoloration.
yes, brownish discoloration on the teeth. Tetracycline.
Gross yellow teeth.
Correct. Do not take with milk. Okay.
Doesn't
Good.
have to for antibiotics.
Kathy, deck. Give me one.
Doesn't you not take milk though for antibiotics too?
Most. I cannot say all. Yeah.
What are narrow therapeutic?
Okay, so therapeutic index. Lethal dose versus therapeutic dose, right? So sometimes a drug can have a very thin line that separates the therapeutic dose or the dose that's effective, right? And this is the lethal dose. Very narrow. A matter of 0.1 can kill somebody. Okay, so that's what you call a narrow therapeutic index. Okay, very thin. So these are part of your dangerous drugs.
So you have to be extra careful with those.
Extra careful with those, yeah? There's a very thin line that separates the therapeutic dose from the lethal dose. Let's go. Rainy, deck.
It's an oral drug, and I wanted to know what are all the differences between the oral, the pills, and
Olo.
Beta blocker.
Beta blocker. I heard it. They end in Olo. And what is it for?
That is for high blood pressure.
High blood pressure. Correct. Decreases high blood pressure. Remember I told you I saw a cheesy meme or GIF, whatever it is, that says if you take your old law, okay, your blood pressure is gonna go down and it will make you LOL now.
Oh, wow.
Right? So beta blocker. A couple of uses of beta blocker. Yeah, number one would be for hypertension, but know that this is also used for preventive. What does Miss J have? Maintenance. That's new. It's a new problem. Okay, that's a new problem.
Yes,
What does she have? Does she tell you?
migraines.
Migraines. So OMOS can also be used for migraines, preventive for migraines. What else? Do you remember? Hey, there you go. Glaucoma. Good job, guys. Very, very good. I think this is a productive 1 hour. Okay. Yes. We will continue. But to those of you who need help with the deck, let's figure it out. I don't have, what do you call this? We don't have internet. So it might be that. But can somebody stay too to walk them through like the deck creation? Okay. So checkpoints. I added, I think, 4 more checkpoints while sitting in the parking lot this morning. Okay, added 4 more checkpoints. So right now, no test. Okay, no test, it's just 25, 25, 25, Okay, and then 25 practice tests, 25, 25, and then the next one will be put all of those together. Okay, so we can see where we're weak at before we have the practice assignment and then the final test for medications. Medications will take a while, like I said, okay? Even if you guys heard me do this, it might be worth repeating because you forgot, right? Okay, any questions? I will send a copy of this to the ones who aren't here.